Hi, everybody. Thank you again for joining us this morning for our next in the series of our grant writing basics workshops. This is focused on budgets, everybody's favorite category and topic. So thank you again. We see some recurring faces and names here. We're so excited to continue this series. Again, this is in response to some common requests and needs that we've been seeing throughout our work here at the Resource Center for the past 5 years. And we just really want to provide everyone with the resources from our amazing contractors and subject matter experts in these various topic areas. So on that note, we do have a wonderful guest here of Hunter Adams, who will be giving us our overview. But on a logistical note, as per usual, please feel free to drop in your questions throughout the presentation. Hunter has a few spots where he'll be kind of checking in with folks to make sure that everything is clear, but feel free and we will do our best to address that as soon as possible. Otherwise, there will be time for some questions and discussions at the end. These recordings will be sent out to everyone who registered and posted on Local First's Local Learning Lab, as well as being a resource kind of forevermore on the Arizona Economic Resource Center's webpage. With that, I will pass it on to Hunter here. And thank you so much for coming and being here with us today.
Thank you, Nina and Robin, and just a special thanks to the Resource Center for having me. Before we get started, I just wanted to introduce myself. So my name is Hunter Adams. I am the current CEO and one of the early founders of Creek Valley Health Clinic. We're a nonprofit, federally qualified health center that serves the rural area of Colorado City, Arizona, and the surrounding area. We were established back in 2018, and since then we have received many grant awards, about 135 grant awards that have spanned across federal grants from HRSA, SAMHSA, the CDC. We've also received grants from the state of Arizona as well as the state of Utah. We've received some grants from Mojave County, as well as some private funders, philanthropic groups, and foundations. Prior to starting Creek Valley Health Clinic, I worked with Intermountain Healthcare up in Salt Lake and did corporate finance and large data analytics. I've got my undergrad in finance and a master's in business administration. So I'm really excited to be here and share what I've learned about budgeting as it pertains to different grant programs. Really quick, I was really impressed when Nina sent me the list of those that had registered for this presentation. We have got a wide array of people here with us today, which I think is amazing because in the nonprofit world, collaboration and relationships is really key. I just wanted to pause and just mention a few of those that have joined us on this call. We've got people from government and public agencies, including police departments, cities all across Arizona, as well as counties. We've got members from tribal communities, social service and family advocacy agencies, safe housing programs, including refugee programs, as well as domestic violence outreach programs, food insecurity and food bank programs across the state, youth leadership and development groups. We have some educators all the way from pre-kindergarten to university research centers on this call, conservation, land and water organizations, arts, culture, and science institutions, and then we've got private businesses, farms, faith-based, and some professional service firms. Just what a wonderful group. Thank you for joining me. I want to just mention my experience is predominantly in healthcare. And so just as a quick disclaimer, I'm not a CPA, I'm not an attorney, and what I'm about to share is really my experience through successfully applying for and receiving, over 100 grant awards and being able to manage and track those over time. So without further ado, let's talk a little bit about today's agenda. My presentation is split up into three major sections. So the first that we're going to go over are funder expectations and the differences in budgeting, whether you're applying for a federal grant, maybe a city or county grant, or maybe a foundation grant. Because although the core principles of budgeting are the same across these different programs, there are some differences that I wanted to share and highlight prior to diving into the nuts and bolts of budgeting in the presentation. Next, we'll be talking about the actual process of building a budget, the different types of budgets that we as small organizations have, different expense categories. I'll touch a little bit on zero-based budgeting, which is what I use mostly in my grant writing and budgeting experience. Project and budget narrative alignment, and then I'll provide a project budget example towards the end of that section. After that, we'll go on to post-award, tracking the grant that you received on the financial management side, and budget amendments, the requirements for audits, and then any next steps and resources that we can share at that point. So let's dive in. As far as federal and state grants, if there's one thing that I would want you to take away from this slide is the words that are highlighted in red, that these are very rigid and form-based, they're competitive, oftentimes they have a review committee, and everything is very much spelled out for you. The notice of funding opportunity, or the NOFO, will usually have all of the instructions, and these grant applications are very, very structured. The project narrative pieces, but also the budget is. So my advice to you here is follow the forms exactly how they're written. Most of our federal awards will require both a line item budget, or a high-level budget, as well as a budget narrative that goes deeper and defines each line of that budget. Typically, the budget template for these federal awards include defined cost categories. These include your costs related to your personnel, which would be your wages and salaries, your fringe benefits, which would be your medical, dental, vision insurance, 401k contributions, health savings account contributions, any benefits that you provide to the people that are working through the program that you're applying for. Travel cost, equipment and supply cost, contractual agreements or contractual costs, and then any other cost related to the project. Before I move on, the difference between equipment and supplies is really whether or not the expense has a depreciable life, which is typically over $10,000. So if you are buying a large piece of equipment, like in my world, maybe that would be an ultrasound machine for $30,000. We would depreciate that over time. That would be counted as equipment. Supplies would be more of your lower cost things that don't really have a depreciable lifespan. So it doesn't necessarily have to be single use supplies, but usually that $10,000 threshold determines whether something is counted as a piece of equipment or a supply. As far as federal awards, if you receive more than $1 million in federal awards, you're required to have a single financial audit. And when it comes to these federal and state grants, there's just little to no flexibility. If you miss the budget narrative or if you incorrectly format a form, it could disqualify your entire application, even if you have a strong story and a strong narrative. So the keys to success here, read and understand the notice of funding opportunity. I like to build a checklist on all the required components for these, and then have more than just your eyes on it. I feel like grant writing is not, it shouldn't be and should not be a one-man show. You should definitely have a second pair of eyes and have someone review the content that's created, as well as a review for compliance. So let's move on a little bit more granular to local, city, and county grants. So oftentimes these follow a similar format as the federal and state awards, but usually these are called request for proposals or request for applications. The one thing I want to mention here are that relationships can go so far with getting these. So get to know your county supervisors, your board of supervisors, your mayor, city council, your chamber of commerce, your elected city council or other local economic development staff. One example of where a relationship really helped me recently was Mojave County received some funds from the state for the opioid settlement grant program, and they had to use these dollars rather quickly. I had a county supervisor that reached out and said, hey, what are you doing as far as your opioid reduction and prevention services? And so we had a long conversation, and he said, please apply for this program. We would love to help fund some of your efforts. And without that relationship, I don't know if I ever would have gotten that call, and we might have been overlooked for an opportunity such as this. So we still had to follow a request for proposal. We still had to go through the competitive review process. But kind of knowing who your elected people are and kind of knowing what funding comes down the pipeline can be really powerful. especially as you kind of prepare your budget, because in that conversation we can discuss what is the county trying to do, what are the allowable funds, kind of how can we develop our program with your vision in mind. And then also just the local decisions oftentimes reflect their personal trust in you as the leader of your organization, as well as your proven track record. These budgets may look similar to federal and state applications, but at the end of the day, don't be afraid to ask questions. So I feel like the more granular that governmental budget or grant opportunities become, the more those relationships matter. So now if we move a little bit to a different style of grants and budgeting, and that would be your corporate giving and your foundation grants. And so oftentimes these are very, very competitive because they may not be deeply granular to your geographical area. So if you're going to apply for a foundation that serves all of northern Arizona, we might be competing against those in Cochise County, Flagstaff, the Native American tribes, Colorado City. There's so many different populations that could be provided care or service with a foundation focused on northern Arizona. So the keys here, I feel like relationships are still strong, but very much mission alignment. Oftentimes, these grant applications they publish a specific mission or vision or strategic priorities, and you want to make sure that the program that you are applying for really is closely matched with their vision. Um, there is, with these opportunities, this could open up a door for long-term partnerships and not just one-time funding. And then one thing I would say with these budgets is these vary widely. Some of these applications can be 100 pages for a $10,000 award. Others can be a very, very brief budget, and it could be a 3-page application for $50,000. One example of which we wrote a grant for a foundation, and what they were looking for was a medical and social service agency as co-applicants for the grant. So we had to create a budget for us and a budget for the social service agency, and then bring it together with the project narrative. So it was kind of merging two budgets together. That was the only time that I've seen a budget be created in that way, where you have two co-applicants. Others, there was one grant that was $10,000, but it was so nitty gritty on the budget detail. Like they came back and they asked so many questions about how did you come up with this dollar amount? How do you have policy and procedure for this, that, or the other? So the reason why I kind of wanted to talk about this is that although budgeting, as I mentioned, is there are some core key principles. It can look a little bit different based on the industry that you're in and the type of funder as well as the opportunity. Okay, so I wanted to stop there really quick to see if there are any questions or if I should move on to actually the nuts and bolts of the presentation. Nina, do you have has there been
There's
any questions or anything?
nothing coming up in the chat, but
Okay,
yeah, looks like you're good to go. Got thumbs up.
awesome. Awesome, great. Thank you. So now let's move on to the actual, building of a strong grant budget. So first, I wanted to discuss the different types of budgets that you might be asked for when creating a grant application. So the budget that I feel like most of us are most familiar with is called the operating budget. So that is your annual budget. Usually it's approved by your board of directors. It includes all of your revenues and all of your expenses for a given 12-month period for your fiscal year, if you may. When we get a little bit more granular, you'll have program budgets that live underneath your operating budget. And this is a subset of your operating budget tied to one service line, or some of us might call those departments. So for instance, at my organization, we have about a $7 million annual budget. Our dental program is about $1.1 million. And so our dental program is tracked separately as a program underneath our operating budget. And we do that for a number of different reasons, for Medicare and Medicaid reporting, for our audit, and many other reasons. But typically, and the programs can be big, like complete departments. They can also be small and include just one or two staff. You may consider your finance team a department that's under your operating budget, and they might have a couple of staff members that oversee all of your financials, your accounts receivable, accounts payable, etc. underneath your programs, you might have project budgets, or these might be pilot projects, really small, innovative things that you're trying to accomplish at your organization. So, taking it one step further for my organization, within our dental program budget, we've recently explored piloting a dental produce prescription program where a dentist can talk with kids about their oral health. They can give them a $7 voucher for brushing their teeth for seven days. And then at our local marketplace, patients can go in and they can redeem this produce prescription for fruit and vegetables. And it's a really good way of kind of talking about oral health and nutrition with our kids. That's a project budget that we received a small grant from the state to pilot that, because produce prescriptions are typically talked about in medical offices and kind of as part of a chronic disease preventive measure. We kind of thought about, what about putting this into a dental and like integrating it into dental to try to kind of look at that whole person care. The state really loved that idea. They said, here's what we want you to report on, here's what we want you to track. We'd love to help fund that specific project. And so they gave us a little bit of dollars to kind of help with the administration of that. So when you think of kind of a rolling like profit and loss, revenue versus expenses, the vast majority of budgets that you'll be thinking of is your operating budget, your program budget, and your project budgets. Your capital budget, you'll notice it lives outside of the circle. So capital planning is something oftentimes that your executive leaders and your governing board. Capital planning are for major long-term assets. They're typically if you're going to build a new building, if you're going to renovate the space that you're in, or if you're going to purchase major equipment. So usually that's a multi-year plan. So if you want, like the quote that I love is, if you want to build a building in 15 years, start planning for it today. And that capital budget, that capital planning kind of slices and says, okay, each year within our operating budget, what amount of net income do we need to help contribute to our capital plan so that in 15 years we're able to buy X, Y, or Z. My couple of points down here in red. So typically your grant applications are going to request either the program budget or the project budget. I've seen some grant applications request the entire operating budget, but that's on the rarer side. What I actually see more so is, instead of your operating budget for this year, granting agencies will ask for your audit from your prior year. So they'll look at all of your expenses and your financial management. So let's say we're applying for something in 2026. They'll ask for your 2024 or 2025 audit, whichever is available, whatever the most recent audit is that you've completed, and then the budget for the specific project or program that you're requesting funds for. So moving on, so as you're creating a budget, you have a variety of expense categories that you'll want to become familiar and aware with. So first off would be your people, and this is where the vast majority of my expenses live within my budgets. Now that could be different based on the industry that you're in. If you're in water reclamation, there may not be as much in the people cost as much as the infrastructure cost. But in the nonprofits that provide services to other people, personnel and your fringe benefits are usually the largest budget category by far. And so your personnel include your salaries, wages, and then also the FTE, the full-time equivalent that person will spend on that particular project or program. Your fringe benefits include your FICA, your health insurance, 401k, health savings accounts, and other benefits. Typically, now this is a wide range among nonprofits as well, but usually your fringe benefit rate will be between 12 and 30%, depending on the amount of benefits that you provide to your staff, if they're full-time versus part-time, and a number of other factors. Typical nonprofit budgets, I should say service-based nonprofit budgets, 50 to 70% of your costs typically are in the people that are doing the work. The next 15 to 20% are your other direct project costs, which could include your travel fees, your supplies, your equipment, your marketing, your payments, your outreach, office supplies, basically everything that you're paying that are directly correlated and supporting the project that you're applying for. Lastly, there are indirect costs, and the way that I think of indirect costs are everything that are not particular to your project but shared across the entire company. So this could include your shared leadership time, the information technology expense that you have as a whole company, your rent, utilities, insurance. Usually this is around 10 to 15% for those that use an indirect cost method. Just a note, the Better Business Bureau recommends that no more than 35% of your budget should be spent on overhead or indirect costs. Now, a disclaimer here, you don't have to use indirect costs when creating grant budgets. So my organization, in all of the 135 grants we've received, we've never used any indirect cost. However, nonprofits can claim this usually either through a negotiated cost rate called NICRA or a de minimis standard rate of up to 15%. The instructions for using an indirect cost are typically included in the Notice of Funding Opportunity, the NOFO, for your grant applications. And then, like I said, many nonprofits waive the indirect costs. And the way that we do that, so our accounting system is a little bit unique in that we're not solely grant funded. We also receive what we call program income, or income from reimbursable services that we provide. So when we provide care for someone, we use the program income that comes in to pay for all of the administrative and overhead and utilities and rent and things like that. If an organization is solely grant funded and the only way that they get revenues is through grants, you'll likely have to use some indirect cost method because it's cleaner, I think, on your grant applications to not list, oh, X amount of utilities are going to be spent on this program. Usually we just omit utilities and we say we use program income to pay for our utilities. And it's just such a low amount in our overall budget that we don't need to lean on grant funds for our administrative overhead. Hopefully that all makes sense. And if you have more questions on indirect costs, I'm happy to review a little bit more on your certain organization's situation and the way that you do budgeting. So moving on a little bit, so the methodology that we use is called zero-based budgeting. So that is where all of the revenues tie to all of the expenses for that given project. So in the nonprofit world, we may have net income at the end of the year in our operating budget, but when we create a grant budget, we don't want to show any net income. We don't want to show a profit. We don't want to show that we have a reserve, and you really don't want to even show a contingency so much as you would maybe an indirect cost. So this suggests that every dollar that you request is tied to a specific expense, which ties to the project or program that you're talking about in your project narrative. Some grants require a match, and in there you would put your match dollars. Let's say you're applying for a $100,000 grant, which requires a one-to-one match. You'd put $100,000 of a company match, whether that be through program revenue or donations or other grants, and then you'd include the grant budget for $100,000. So you'd show $200,000 of revenue, $200,000 of expense, and then that shows kind of your zero-based budget for that grant award. I will say that your match can be in cash or program contributions. It can also be discussed as in-kind matching in your project narrative. I will say talk to your finance and accounting team about that because it can be a little bit tricky to track in-kind time and effort that doesn't flow through the payroll system. So I know when we do reporting for our federal and state grants, oftentimes you need the documentation to support the report that you're having to the federal and state government. So documenting the match dollars can be through timesheets, meeting minutes, signed volunteer logs, or other documentation. But just know that anytime you get a grant, you might be audited in the future. So make sure that you're talking about time and effort and making sure that you can track where the match dollars are coming from if a match is required. Okay, so before I get into an actual example, I just wanted to mention here that your project narrative and your budget narrative have to be aligned. And sometimes I think the person or the team at your organization that is writing project narratives are not the same people that are writing the budget narratives. And so it sometimes comes in a siloed approach. So if the narrative says that you'll hire a half-time, part-time coordinator, your budget should reflect that salary as well as the FTE as well as the fringe benefit cost. If the narrative mentions travel cost or travel required for the person managing the program, include that in your budget because it could create a red flag on a reviewer's mind. If the budget doesn't match the narrative or if the narrative doesn't match the budget, this can cost you points and maybe it doesn't mean that you're not funded, but it could cost you review points as they're scoring all of the applications. My last bullet point here are just some common key errors are related mostly to people. Either the FTEs don't match, or the salaries don't match, or there's someone completely omitted from the budget that's talked about in the narrative, or vice versa. Um, just make sure that you have your finance team and your grant writers are on the same page. And honestly, the review is key. I during early on when we first started, I had a review committee that was a subset. It was a couple of people on my governing board that really just wanted a little bit more engagement, and they didn't do any of the actual writing or the preparation of budgets, but they were a great a couple of people that I could say, hey, will you review these documents and see if you can find any disparities? You could, yeah, there's just a lot of different ways that you can make sure that those are in alignment so that you're not going to cause any red flags or alarm bells to go off during the review process. So moving on, so here's an example of a line item high level budget. So let's say that this is just an example that you are applying for a 12-month outreach program for low-income, uninsured Arizonans. Your target is to support 200 patients through 1.0 full-time community health worker CHW. So first off, note that it's zero-based, so you have so there wasn't a match required. So I'm talking about the revenue is 100,000, would be like the grant revenue that we receive, and the project budget would be 100,000. So let's say that this project got to just exist all on its own under my organization. I list here as my high level line item budget, personnel cost 50,000, fringe benefits is 25%, travel, supplies, contractual, and then other, transportation vouchers, outreach, training, and certification. If you were a grant reviewer, this wouldn't be enough information. You don't know enough about the project, and that's why many grant applications require a budget narrative to live alongside this line item budget. So let's take it a little bit further. So this is the same budget that we just barely talked about, but it's in a narrative format. So the personnel cost, the community health worker at 1.0 FTE and 40,000 annual salary, plus a registered nurse, clinical supervisor at a 10% FTE times 100,000. So now it's like, oh, okay, so there's two people being funded through this grant. Hopefully in the project narrative it said an RN supervisor is going to support this program, and the CHW is hired at $19.20 per hour or something along those lines, which could check out at that 40,000 annual salary. The fringe benefits of 25%, you could say, okay, these are benefits that cover your health insurance, your retirement, FICA, and workers' comp. 25% is a fringe benefit rate. That checks the gut feeling for a reviewer that sounds great, and hopefully it's supported by your actual you could say historical cost for benefits covering health insurance, retirement, FICA, and workers' comp, so that the reviewer can say, okay, that's their actual fringe benefit rate. Travel, mileage for home visits calculated at 287 miles per month for the community health worker at 12 months, for 12 months at this IRS mileage reimbursement rate. Great. Supplies could be your blood pressure cuffs, and I could have gone a little bit granular and said $1,000 for blood pressure cuffs, $1,000 for glucometers, $1,000 for pulse oximeters for home assessments, and then $1,000 for printed patient education materials. Awesome. Contractual, let's say you pay, and let's say you had a phone-based interpretation service for Spanish-speaking patients that was $650 a month. I could have put that $650 a month, and then that would check out to be about that $8,000. Gas cards and rideshare credits, bilingual flyers, training and certification, CHW certification for 5,000, continuing education, and cultural competencies staff. So I know I could spend a little bit more time on this, but overall, if you see this budget, if a reviewer was to see this budget, could they tell a little bit about what the project is about? And if they read the project narrative, could they kind of guess what your budget might look like? That's kind of what you're trying to allude to, is that there's enough connection between your project narrative and your budget narrative that the reviewer can kind of be like, okay, it passes the gut check on both sides. Okay, I'm going to pause there. Do you have does anyone on the call have any questions on the building of a budget, or are there any questions in the chat, Nina, that I could go over?
No questions as yet, but I did want to just point out that we've seen some grants require zero-based budgeting for their application. And so that's just something, again, what you addressed earlier on in the presentation is that you want to really look at the notice of funding opportunity or the RFP or any other details that you can prior to building out your budget, because oftentimes we have seen folks get their application sent back because the program budget or that's associated with the grant does not match, or the project budget doesn't match with what is being requested. And so just as a heads up there, that is something that we've seen grantors be really strict about.
Awesome. Yeah, thank you for that context.
Mhm.
And the Resource Center would probably be a great place for some of those questions too, because you see it
Yeah.
across all industries.
Hmm.
Not just healthcare, not just infrastructure. I think that that's a great place if you have questions on your specific notice of funding opportunity or would like some extra help. The Resource Center is a great place to start.
Yeah, thank you.
So all right, so let's move on. So let's say now you've received your award. Congratulations. Now what do you do? Well, you have to make sure that you have a process in place for your budget tracking or the tracking of the actual grant that you're spending, the tracking of your program. So before even applying for grant funding, I should say, even but especially before receiving a grant, you should really talk to your accounting and finance team, making sure that you have an accounting process. You're using separate codes, customers, or class systems for each grant that you receive in your accounting system. Never combine your grant dollars with your general operating funds or donations or any other dollars, as the grant dollars they can be audited in the future. And then you want to tie each expense to the specific grant revenue with supporting documentation. So the way that that looks like for us is we have separate classes. We use QuickBooks, and we have separate classes that identify the class for basically the grant is the class. So it recognizes the revenue, and then below it recognizes the expense, and then we can run reporting based on different classes. So if we only want to see the federal grant awards or the federal grant program dollars that we've received, we can run a report and say, okay, we received this grant for behavioral health integration. These are the expenses that all tie to it. How does that align with the budget that we submitted? And go from there. So you have your budget and your actuals, and then you can see if there's any variance there. A pro tip is to really run monthly budget to actual reports and make sure that your executive staff and your governing board is at least reviewing financials quarterly. We actually do it monthly, but just making sure that everyone has eyes on your budgets, especially on your federal awards. And then, yeah, just make sure if you're a small rural agency, just make sure that you have structure and accounting systems in place before spending any of your grant dollars, because it is really difficult to unwind and have to do a bunch of journal entries and reclassify a lot of your dollars if your system is not set up for grant tracking appropriately to begin with.
Questions
Um,
for you, Hunter.
yeah,
Two. It's a
yeah,
twofer, a two-parter question.
great.
One, is there anything that might change if an organization works with a CPA, works with an outside source other than just tracking on QuickBooks? Is there something that they can be doing to help a third party for this?
Yeah, so that's a great question, and I have a little bit of information on resources at the end of the slide. So we work with a CPA firm during our annual audit process, and they've given us some great feedback and great advice to kind of strengthen our system. But yeah, I think if you it kind of depends on who your finance director and kind of their experience with grant tracking is. We were really fortunate in kind of landing an amazing finance director with 20 years of nonprofit experience. And he's just been through so many audits that he kind of knows what questions the auditor is going to ask before they even come out. So that's resulted in really, really clean audits for us every year. I recognize not every company will have that luxury and have that expertise. So I would say, especially if you're at the early stages before you've even received a grant, it may be worthwhile to spend $5,000 to $10,000 and have a CPA firm come and look at your system and give you some examples, get some consultancy so that you're kind of starting strong. And then when you do receive these grants, you know exactly the process and workflow because you've kind of had the CPAs review and eyes on your management. Some people also will contract all of their financials out to a third party. I've seen that before, and it's worked well for some organizations, and it's worked horrendously bad for some other organizations. So it kind of depends on the financial firm. But I always think getting a CPA's eyes on things before you start spending is a great idea.
Yeah, and we've seen we've worked with some organizations who have a fiscal sponsorship with a particular fiscal sponsor, and they're able to work with that. So I think that as just kind of a note to that third party question, there is when you are putting together a grant budget and you are potentially working with a fiscal sponsor, you want them to know too what your intentions are and make sure that they're tracking it in a way that fits with what your intentions are. Theoretically, this is an ongoing relationship that you have with a fiscal sponsor,
Mhm.
and you just want to make sure that they're in alignment with you as you are trying to get aligned for this grant.
Yes, definitely. And I think clear is kind, and so mentioning the fiscal sponsor, mentioning that relationship, your track record, and also involving the funding agency. If there is a foundation or someone that is giving money to a fiscal sponsor to really support a mini project in someone's community or area that's hard to reach, there's nothing wrong with that. Just make sure that the funder, the fiscal sponsor, and the end user all are on the same page.
And perfect. And my second question is, when it comes to budget tracking, is there anything different that should be done based on if it's a reimbursement, based on what kind of awarding it has, be it cost reimbursement, for, you
Mhm.
know what I mean? Is there anything special that should be tuned in for that?
Yeah, that's a great question. So in my experience, there's two ways. So let's say you receive a grant for the next 12 months, and they give you the $100,000, and they give it to you in June, and they expect quarterly reports from June until the next May, but they give you that chunk of change right at the beginning. That's a great example of where that grant will live actually as a liability on your balance sheet and called deferred revenue, where it's revenue that you haven't technically earned yet because it's for the 12-month period. So you've only earned maybe June's amount of that grant. So it lives on a liability as your balance sheet, even though it's cash on hand, which took me a minute to kind of process when I was talking through this with my finance person. At the quarterly point or monthly, you can draw down those dollars. So basically it's living in your checkbook instead of the grant agencies, but you want to track it still very similarly. So you would draw it down off of deferred revenue, so it would come in as your grant revenue for those 3 months, and then you will have supporting documentation that still ties to the expenses that came from that deferred revenue. So let's say in our example, we were paying for that outreach worker for 3 months. We would draw down their salary, so you draw down $4,000 or $5,000. You put it in their salary, and then you would have payroll records that would support as like your backup documentation, so that if someone required quarterly reports, even though they gave you the money up front, then you have that documentation. It's tied to all of the expenses that you used that grant for, and then you send it out. That's that's the way that we've done it. The other way is you oftentimes have quarterly reports, and then you have to attach an invoice because you haven't, you received the grant, but they will give you, $25,000 per quarter instead of $100,000 right now. And so they'll have a reporting template. You may have to provide payroll records or some information on the project showing you're making your way through the project period, and then you submit an invoice along with that information, and then they'll send you a reimbursement check. It's kind of a lot of information, and I'm happy to go over it, and I am not the absolute expert, but that's where deferred revenue comes into play when it comes to nonprofits receiving grants that they haven't yet earned all of yet. Does that make sense, or is that just more questions?
No, that was great.
Okay,
Thank you.
awesome. Great. No, thank you. It was great questions and great comments. I appreciate it. I've only got a couple more slides here. So one is the grant life cycle. So I just wanted to kind of keep this, kind of end with this a little bit, just so that we're all on the same page, where an application is really your best guess. You're predicting tomorrow with today's information. The tracking, if you do receive your information, the tracking should really start on day one, or even prior to day one. Make sure that you have systems in place so that you can track where your award is being spent. When it comes to modifications, you're typically allowed to do some modifications. You're not stuck 100% in place from the time of your application. An example could be, let's say you provided a budget or a grant application in June and it didn't get funded until October. Well, you might have had staff turnover at that time. You may have hired on someone. You may have, you may have lost other program funding. Like there could have been something that happened to your budget in that review period. And so typically granting agencies give you 10 to 25% leeway on moving things around budget line item to line item. For us, for our federal healthcare awards, it used to be 25%. They changed it to 10% as an allowable budget amendment, but then just recently they've moved it back to 25% because it got some court order ruling against it for some reason or the other. So, but I'll always ask. Most agencies will be okay, and if you need to submit a modified budget, that doesn't necessarily mean that your grant is in jeopardy. I just think sometimes being clear is the most kind with who's giving you the grant dollars. So just be clear about any budget amendments or any changes to your budget that might happen. After your award, you'll oftentimes have final reports on the program impact, which may include financial reports and also usually returning unspent funds. So make sure that if your grant is near its closeout period, you want to either apply for a carryover if you're not able to spend all the dollars in time, or there's another term called a no-cost extension for federal awards. Just making sure that you're being clear and saying, hey, we have a plan to spend down these unspent funds. Or if you just can't, then oftentimes they'll claw back those funds at the end of the grant period. And then, like I said, a single financial audit from an external CPA firm is required if you receive over $1 million in federal funding. And a funder can typically audit the grant that they've given you after the fact. Many CPAs will recommend maintaining documentation for at least 7 years, as that covers the IRS look-back window. But just make sure that you're kind of going along with your own financial policies and best practices and standards.
Hunter, if this is their first over $1 million grant, are you able to write the cost of that CPA's services into the original grant, front loading it, knowing that that's going to be a thing that you have to do, and if you don't normally have that service,
Yeah.
right? This is your first grant. Are those the kinds of things that they should be forethinking and putting into that initial grant application?
Absolutely. Yeah, that would be exactly the project cost and a related, and that's not an indirect cost. That is exactly to the project that's pushing you over to that $1 million. So I think that's absolutely allowable. And to give you a ballpark range, every CPA firm is going to be different, obviously, but we received 3 or 4 bids back 5 years ago or so, and we've spent between 8 and 20,000 for our single financial audits each year. So I think budgeting depends on where you're at, depends on how competitive the area. Not a lot of CPA firms do government work, but I'd say about 15 to 20,000 is probably a good metric to plan for. And look at your local school district, whatever auditing firm, because school districts have to go through a single financial audit. Look at who they're using, and that may be a good place to start if you're struggling to find a CPA firm that is comfortable with grant awards and nonprofits. Because the same firm that we use does, I believe, both our local city audits as well as our school district audits. Great question. Okay, so next steps, these are not necessarily in order because I think as I was reviewing this earlier, I would like to start with number 7. Identify on your team who can support with grant writing, the budget development, post-award tracking, like kind of start with a team. Like I said, don't make this siloed in just yourself or just one executive leader. I think grant writing can be viewed as a single point of failure for a lot of organizations, where if the CEO or the grants management specialist at your organization leaves, that's a huge gap that the organization has to now fill. So compile a team of 3 to 4 people, include a board member for review as well. If you have an engaged board member that is a past or current educator, they're a great one to kind of review and look through things. Now I'll go to 1 through 6. Start with planning, with your strategic plan, making sure that you know your organization's operating budget, the different programs that already exist at your facility, innovative projects as well as current projects that your organization is doing, as well as capital needs. Because okay, my story with capital needs, we're getting close on time, so I want to be mindful there. But I heard for years that our community needed dental services, and I just thought, you know what, we can't do dental services until we have walls and a ceiling. And so I kind of thought of that, kind of made floor plans, kind of just thought, well, I'm going to put it out there in the universe that we need funding for a dental facility. And in 2022, we were awarded $700,000 to help get some dental operatories expanded onto our current space. So I was like, wow, that's amazing. And then fast forward a little bit, I'm like, well, we need the dental chairs now. And it came right at a time where there was like federal capital funding available, like on the heels of COVID. And so we were able to purchase and equip for dental operatories. Like it was crazy to think like, okay, if we want to do something in 5 years, what do we need now and how can we kind of grow into that? So a capital plan, I just think it's so valuable just to be thinking of in the back of your brain, because you never know when something is going to come out that could propel your organization to tackle a construction project or something like that. Structure, make sure that your accounting, this is mostly along the finance and accounting structure, make sure that you have a system where you use a class system, customer system, or some type of project tracking workflow in your accounting systems so that you're tracking the expenses that are tied to your revenues from grants. And also decide on with your accounting team if you're going to use the indirect cost approach, and if you are, go through the next steps with obtaining that for your federal award, and stick to that 10 to 15%. Build reusable budget templates, and if you need some, reach out to me. I have so many different budget templates in Excel and different ones that I can share. I feel like I very rarely start with a blank page. I typically look at a past budget narrative, I roll it forward, and then I kind of adjust the values, adjust the descriptions. And using a template, I think it can be really overwhelming starting with a blank slate. Just make sure that you have a bunch of templates that you can use and identify, for your future grants. Research 3 to 5 grants that your organization might qualify for and throw your hat in the ring for the next 12 months. Relationship building, reach out to your local contacts, your elected officials, your representatives, foundation leaders, and for those of you that are government officials, reach out to your small nonprofits. Ask for a site tour. I think it's really cool for the government, our government representatives, to kind of reach out on that side too. I think it's a great way when organizations aren't asking for something, to go in and kind of make a relationship and go in and see the facility. I think it's really, really powerful. I've had a couple of elected officials and even U.S. Congress people that have come in to our tiny, micro facility in northern Arizona, but it means something, and I think building those relationships are powerful, especially on the local and county side. And then lastly, pull together all of your documentation that's commonly used for grants. This would be your past audits, if you have any, your board rosters oftentimes are asked for, your organizational charts, just any type, resumes of your key management staff. Some ask for what's called like a bio sketch or biographical sketch of your key project people. Make sure you have all that documentation, and then if you need support, if it's your first grant, reach out to the Resource Center. But the first step that whatever consultant is going to ask for is going to be, give me all of this documentation. And if you can have it in a folder that's just easily, you're able to click and just send that, makes the entire grant writing process so much easier. Lastly, there's quite a bit of resources out there. In Arizona, you have the Resource Center, Local First Arizona, Arizona Alliance of Nonprofits. Grants.gov is the main search engine that I've used to find federal grant awards that I've been able to receive. The 2 CFR 200 Uniform Guidance kind of goes over the compliance side of managing federal awards. You can also look at other organizations' audits through the Federal Audit Clearinghouse. So to your question, Robin, of if this is your first audit, what can I even expect? Go into that Federal Audit Clearinghouse, go to a nonprofit that you know that likely has an audit. You can go in and you can see their audited financials. You can see the auditor's note. You can see the letter to the governing board. You can see kind of the process that they follow and kind of the end result, the documentation that you then have to upload to the Federal Audit Clearinghouse following that audit process. Some others include the Council of Nonprofits Budget Toolkit, local CPA firms with nonprofit experience, and then also contractors that you can reach out to with the Resource Center. Also, my email is listed here. I'll give it at the very end of the presentation as well. But reach out if you have a need for any budget templates or if you'd like to walk through this a little bit further. I love getting out of the healthcare space and helping out other small and rural nonprofits across Arizona. So don't be afraid to reach out. With that, I think we have about 9 minutes until the hour. I wanted to just pause and, thank the Resource Center for the opportunity and for putting together this web series. I think it wouldn't be possible without these sponsors. You can find more at the URL right here. And then, as I mentioned for the recording, here's my email. Please reach out to me if you have any other questions. And now we'll go back to kind of the open discussion slide. And see if there's any questions that you all have.
We've
So
got
maybe
We've
sorry,
got
Nina, I was
some
going to
really
say in the
positive
chat.
feedback in the chat.
Good.
Renee says, this was great, helped me understand better on areas such as deferred revenue, and many of the budget review, I believe, has verified I am following the correct processes. So that's great to hear. Thank you, Renee. And yeah, lots of positive feedback otherwise. Again, I think just speaking to your next steps slides, Hunter, that one did resonate with me. And this is something that we've brought up in a couple of workshops here, but it's really good when you're entering a grant to have a project in mind. To have something that you already have the documentation for, you have, at least a rough idea of what the budget might be. You have some planning set up to be able to kind of make this project part of the work that you're already doing. And then the grant can kind of make that even more possible. Oftentimes we see folks who are just applying for grants in order to start new projects, and that just makes this budgeting process really hard, and it can be more time intensive when you're trying to kind of backfill, like, okay, the grant is saying that it'll fund this, and this is how we develop a project to make sure that we fit the grant and all of the things. It is most effective if you have something in mind and you
Yeah.
can really put together a budget and then find the grants that fit that. That's a really helpful way to proceed forward.
I love that review because I think not all grants are good grants for your organization. There have been some that we have said, oh man, we would love to do that, but the amount of time and effort and staffing and the complexity, the logistics of getting it actually done, if we get it, can be paralyzing. So I think leaning on I don't know, strategic planning is one that just comes to my mind oftentimes where I have probably 6 or 7 different ideas of things that we could expand and grow into if funding allows, but 2026 is not the right time for it. But if there is some opportunity to kind of grow and expand our services in next year or the year after, it's nice to have those in the back of my mind so that I can be looking. I think it's hard to look for grants, like you mentioned, if you don't have a plan in place or you don't have programs or projects that you're wanting to fund
Right.
in the back of your mind.
Yeah.
So
Well, I'm getting a lot of positive
good.
feedback here. If there are no questions, I might just
Got my screen.
dive into letting folks know that we do have a survey. Ooh, hold on, Catrice with the last minute question. Okay, how do you recommend building slash including a contingency when budgeting?
Okay, so I have only used contingency line items with capital budgets. And so that typically has been 5 to 8% of the capital budget because I think construction costs, logistic costs, it is nearly impossible, even with change orders. With capital funding, contingency is key. In federal awards and state awards for like programmatic and project costs, there's not a line for contingency. There is for indirect costs, but if your budget changes, so if you apply for 100,000, but your project ended up being 110,000, you're still kind of stuck with that $100,000. There's not really a contingency, and as a grant reviewer, they, as Nina mentioned, have gone to kind of that zero-based budgeting. So there's really not a lot of opportunities to use contingency. However, I would strongly recommend using it for any capital. If you're buying a piece of large equipment, if you're building a building, if you're renovating your space, I've found that in capital budgets, it's much more allowable. But that's my take on it. That's my experience. There could be different, and it does depend on the grant. But thanks for your question.
Awesome. Thank you. And thank you to Chris. So Robin just put in our chat that we do have a survey where we are asking your opinion of how you feel this particular workshop went, and also give you the opportunity to share other topics that you'd like to hear information about. But that does speak to the fact that we have this series. It is ongoing, and we do have a few more over the next several weeks. So please tune in. We've got lots of other ways. Hunter mentioned some compliance talk with to CFR. We have that coming up for you. We've got a really good lineup of speakers, and we hope to continue to inform you as you go along your grant journey. I will end it there, give you all a few minutes back, and just want to say a sincere thank you to Hunter for leading us through and really helping explain. This was really, really helpful.
Yeah, thank you all so much. Thanks for having me. Thanks for your engagement, your questions, and for carving out an hour in your midday. I appreciate it. Nice to meet you all, and reach out if I can do anything else.
Thank you.
Bye bye.
Bye.